Hey everyone, welcome back to the Healing Your DID course. I want to thank you for becoming a member to get access to this course. In this topic, we're going to be talking about alternative ways of handling DID. There is no one-size-fits-all approach when it comes to dealing with this disorder or really any disorder for that matter. Everyone has different experiences and traumas. So what may work for me may not work for you. What may work for you may not work for me and anyone else for that matter. So usually when we approach this topic, I always express it from my point of view, what has helped me. And while certain things may help you, you have to be mindful of the fact that maybe there's certain things that I share that may not work for you the same way it worked for me. So you have to be able to adjust your healing plan accordingly so that it adapts to you and what you can actually like and what you can actually benefit from. Allopathic medicine and treatment follows a guideline without taking into consideration the person's unique circumstances. So as we talked about before with the conventional way that this disorder is handled, it can often be that there is one size fits all approach. You have symptoms, here is your medication. Of course, there's a ton of different types of medication that you can try, but it doesn't handle your unique situation. It is not individualized to you. Therapy may be a bit more individualized, but that too follows the guidelines of the one-size-fits-all approach. So you have to be able to adjust it on your own to what works best for you. One of the alternative ways of dealing with this disorder is hypnotherapy. This is essentially like a meditation, but it relaxes you to a deeper state to bring out certain things within your subconscious and unconscious mind. People with dissociative disorders are highly suggestible. So if you have a dissociative disorder, you are more suggestible than the overall population, and this is because of how denial and dissociation works. Dissociation is basically hypnosis. You're performing hypnosis on yourself to bring about different ways of thinking. This is why different personalities can be so different from one another. This is why there are certain compartmentalized ideas, thoughts, and traumas that are within certain people with an amnesia barrier. It is hypnosis. People have hypnotized themselves due to trauma that they have endured. Hypnotherapy is when you get into a relaxed state and it brings out memories in the subconscious mind. So this bypasses this amnesia barrier. The amnesia barrier is the ego. If you look at it like that, the amnesia barrier that exists is your ego. Your ego is preventing the healing. When you're doing hypnotherapy, the ego is not present. It goes right past that. It's not present to stop the flow of ideas. Instead, the flow of ideas, the stream of consciousness begins to flow, and a lot of these traumas will come out. With hypnotherapy, you can also bring out other personalities. And this is because you're much more in control of the way that you're handling this disorder. So you're able to bypass the ego and actually bring about certain states on your own to deal with some of these sorts of trauma, because each personality is going to have a different way of handling the trauma and different memories that they harbor that needs to be tackled by a therapist in order to fully heal. Hypnosis is what caused DID. Now, while we talked about trauma was the contributing factor of that, which it very much is, trauma is what caused someone to dissociate. It is the hypnosis and repeated affirmations by the person themselves and by the abuser that caused the dissociation. What affirmations do essentially is when you repeat it again and again and again, endlessly essentially, you believe it to be true. So with the person who has been abused, they will continuously repeat certain affirmations to them in order for them to deal with the abuse. They will have certain ideas within their mind, maybe living in a fantasy land, to trigger certain states within them when they're very young. And this is a skill that they learn very easily when they're younger, so they're able to really harness the full potential of their mind. But the abuser can also instill these affirmations within them, such as a very common example is when Parents tell their child that they're not worthy, that they're not deserving of anything, that they will never amount to anything. So what happens then is that the child believes it to be true because that's what they've learned from the abuser. But that's not the reality of the situation, but that will stick with them until they're an adult, well into their adult years, until they're able to tackle that. Hypnosis will allow you to go deeper into your mind to see where that originates from, to tackle it. In our next topic, we're going to be talking about trauma therapy.